being able to get a lot of questions answered helps people feel better about medical cannabis. Um, First of all, how can I feel asleep and stay asleep? I think Greg, if you're there, can you help us answer that one?
Yeah, definitely. The problem is to like make sure that you've taken care of everything that could be going wrong with the daytime before you think that it's a medication, medical marijuana that you need to help you fall asleep at night. Waking up during the night, sometimes there's a lot of different things that can go on. We always look at like, is it the first third of the night or the last third of the night where you have waking problems from sleep? But it depends on what's going on. But staying asleep the whole time, I'm not sure that without knowing anything else, what the answer is.
Well, I think, like you mentioned when we went through the slides, looking at why you're having trouble falling asleep, a lot of the reasons, I think this is where I'd recommend to really answer that question, to address it with a sleep professional. I think that's the best way to really handle it.
Yeah,
you got to really find out what is causing that to happen.
From the talk, the idea of like being on the backside of the circadian rhythm and having enough sleep pressure to fall asleep naturally. If you know that you've done all the things right, that you can look up online for sleep hygiene and circadian rhythms, and you're still not falling asleep for whatever reason, medical marijuana, it may be the answer to help push you off the edge to like fall asleep. So it's a good idea. And there was another question that I saw in the chat room is like, well, is it going to affect the kind of sleep that I have? And, medical marijuana. And it is true that it can affect the amount of REM sleep that you have, but it's not going to change the overall pattern of sleep that you get. If you're going to get deep sleep, you'll get it. It decreases as we get older. And I've seen like hundreds of like older patients that didn't have any deep sleep, restorative sleep, but they're still okay. But it's infants, pediatric patients that have the most deep sleep.
Yeah, I think medical cannabis really puts you into probably the most natural sleep state out of all the different, let's just say, medications that you take.
Yeah, exactly.
Some of the pharma medications definitely have some reactions that are
I can see them
marijuana.
on EEG. Your brainwave pattern will show up to have like issues. If you're taking any of the benzodiazepines, a Valium class of drugs, it'll show up. Is like in what they call an increased sleep spindle density. So you can see some medications that you take on brainwave activity while you sleep. So yes, it will cause problems.
Good. Let's run on to the second question. I usually take an indica capsule to help me sleep. Would increasing the dosage help it last longer to keep me asleep? Lisa, do you want to attack that one, or you want me to take it?
Take that one. Yes, potentially, especially if you've been using it for quite some time. You can build up a tolerance to cannabis and to the THC that's in there. And so that's basically, you could do either. You could take a break, maybe a 2-day tolerance break to help sort of reset how your body responds to the cannabinoids, or you could increase the dosage just a little bit, and that might help keep you asleep a bit longer.
Sure. Now, I do want to point out, you were talking about taking a holiday.
Yes.
I think a lot of people don't realize that if you're using medical cannabis, it's a good idea every maybe 6 to 8 weeks to take a day. They actually recommend 4 days off. Just stop using it. And the reason for that is what it's doing is it helps your body reset. It helps you, the cannabis you do use becomes more effective. It helps your body be able to start really producing its own endocannabinoids because it gets lazy. If it's getting it from the outside, your body kind of just sits back and says, well, I'm not going to produce it as many as I need. But it helps your body get back into that cycle, which is really important. But I think the other thing it lets you do is be able to know that cannabis is, in fact, something that can really help you. You're not what you mentioned, you're not building up a tolerance. It's a negative type of tolerance. Now, I say it's 1 to 4 days because in my particular case, I have herniated disc in my neck. If I go about a day and a half, my neck taps my shoulder and says, you better do something within the next day or so, or you're going to really feel it. So I really can't go more than a day and a half. I'm not addicted to medical cannabis. I can stop at any time. I have no negative effect on my body when I stop using medical cannabis. What I am addicted to is getting rid of my pain. With 7 herniated discs in my neck, which is an inoperable condition, I can wake up sometimes with a level of pain of a 7 or an 8. So to get that level down to a 1 or below, to be able to basically conduct my business during the day and interact with people, I really want to be able to have a dosing regime that I know works both morning, midday, and night, because it's not something that's going to go away. But also, by being able to take my breaks now and then, I find that I use less medical cannabis and it's more effective. Something there. You've seen a little bit of that, haven't you, Lisa?
Absolutely. Yeah, I would say that everything you've said is right on. Where there is no, at least for most people, there is no physical withdrawal when it comes to cannabis. It's not like other drugs where you'll have these really negative effects because your body is like physically addicted to cannabis. That doesn't happen. That's
Right.
one reason why it is so well tolerated as a medicine, is that it doesn't have that physical dependency. But like you said, people just, they become accustomed to not feeling pain and not feeling the anxiety and, not feeling the nausea that the cannabis helps them with. But yes,
Sure.
it's a great idea. It helps sort of reset everything. That way you don't necessarily have to take a little bit more, a little bit more, a little bit more if you're using it every single day.
Right. Now, there's a question here that says, why does it work the first time, but not the next time? Boy, there's a lot of reasons why that could happen. I don't have it a really good answer for that one, I say, because it could be the fact that during the day you had an event that really, yeah, it raises your anxiety, for example. It might be the amount of product that you're taking. And again, it goes back to the dosing issue. You should, if you use medical cannabis, if it works the first time, it should work after that without a problem. But again, as Greg was mentioning earlier, what's preventing you from going to sleep? And I know if you have an event during the day where you get anxious, if you have some pain, let's say, that comes into play, you may need to adjust your regime, the amount of medical cannabis you're taking, to be able to address that. And that also relates to a question is, it may be related to events during the day that really can help you stay awake, stay asleep. Again, I can't answer that one without really knowing your regime, but it should work. And I would say do two things. One, get a hold of your medical cannabis provider, your doctor, or go to a consultation with with a dispensary. They can help you identify those factors that keep you from sleeping. I think that's something that really helps. Let's jump on to the next question: is, do the best tinctures for sleep have CBD, CBG, and CBN, or a combination? And that's related to another question that comes up: is CBN necessary to induce sleep? CBN is not necessary to induce sleep. It helps to induce sleep, but I think some of the best tinctures are those. Your thoughts on that, Lisa? I know that those are really key cannabinoids to really help with sleep, and also tied to the terpenes. Is that correct?
Yeah, I would say that, if you wanted to start off with a tincture, starting off with something that has like equal parts CBD to THC would be a really great place to start. That CBD often is really good at handling like anxiety and pain as well. And THC can really help cause that sedation and help with different kinds of pain as well.
Sure.
CBN is definitely not necessary to induce sleep, but it is often found in products that are specifically formulated to help with sleep. And so if you see CBN in a product, it's most likely in there to help you calm down, relax, and sleep, but it's definitely not necessary. And yeah, start off with that CBD THC combination. I think that's really good for most people to start off with. And then you may find that, if you're experiencing more anxiety or more pain, you might want to drift a little bit more this way or that way towards CBD or towards THC, depending on your individual response. But
The key
definitely
is to
that's a
have a little
good
bit of
spot to start.
THC in there to be able
Hey,
to help trigger the entourage.
Mark, I just wanted to add on to what Leah's saying. Like in medicine, it's the same way. It's like what drug and what dosage is the right one, and it's the one that works. So
Yes.
everything that she's saying is absolutely correct.
Good. So let's jump to the next one. Which terpenes help with sleep? I think, Lisa, you answered that, right?
Yeah, my favorites are linalool, caryophyllene, and humulene. Those are some of my personal favorites and something that we've seen people come in and look for when they're looking for something to help them with sleep. I love the first two. Those are my absolute favorites. I love those in a nice relaxing product. Linalool is the same stuff that's found in lavender. And so a lot of people utilize lavender before going to bed anyways. Either it's in a lotion or a tea or something like that. And, having that same substance inside of the cannabis really, we see it makes a difference. It can really help relax the user before bed and get them ready for that sleep.
Yeah. And I think those are important terpenes. Also, I think some myrcene in there will help quite a bit as well. As another
Yes.
one you might want to take.
But that one's in almost everyone as the most common terpene. It's hard not to find that one. So
Sure. But we have a lot of folks that are new to medical cannabis. So I just want to throw that out there because it's
absolutely
really will help quite a bit. But yeah, that'll help quite a bit. Next question is, if I start marijuana, should I stop taking other prescriptions such as muscle relaxers? Greg, I think this is right in your alley.
The answer is no. If you're going to change medications that have been prescribed, then you have to check with the prescribing physician about what you should do. If you are experimenting on yourself, because you have free will to do whatever you want, decide what you want, and you found out that it seems to be doing really well, then maybe it's okay. But it's a thing of respect to just tell your physician. It was like, this is what I tried, this is what I did, and it seems to be working. And he may drop you from his practice, but let everyone know what you're doing.
Yeah, I think a lot of doctors today are becoming more what I call medical marijuana conscious. 5 years ago, you're right, a lot of people would drop the patients. Now they're more curious about it, and I'd say the majority of doctors today are not necessarily going to drop you. They may get curious, but I think you need to wean yourself off of the prescription drug and then bring yourself up to the medical marijuana side. So it's not cold turkey. Work with your doctors and find doctors that really will work with you. I think the doctors work for you. You don't work for them. And I think that's what's really, really important.
That is true. Yep.
Yeah. So the next one is, I have narcolepsy and I can't stay asleep for long periods of time. What do you suggest? Greg, what's your thoughts?
Well, on this one, it's a difficult thing because narcolepsy has got like components of like a few different things. It's like daytime sleepiness. You also have something called cataplexy, and cataplexy means that you could like go into that sleep state with a surprise or something like that. You might also have like sleep hallucinations. So it's like it's got several different things that go on with it. But there was a medication called Xyrem, or gamma hydroxybutyrate, that was prescribed for like controlling cataplexy and helping with narcolepsy. That would keep you asleep, but you had to take it. You had to like wake up during the middle of the night and take it again, but you would get like a nice amount of sleep. But to find out if there was any comorbidities, if there was another problem alongside of narcolepsy that was causing issues that cause you to wake up during the night, that's an important thing too. But narcolepsy is different, and it's you have to look at it from like a different ways. And that's why I'd say sleep consultation with somebody that's really, really good at it.
Right. I think when you say, what do I suggest? I'd say get a sleep consultation, really, to be able to get down. If you want to really get that resolved, I think that's the best way to handle it. I don't think throwing a lot of medications is really the answer. Is that correct?
Yes.
Great. Does cannabis help with nausea? If I'm late taking my current medications, I have stomach pain, gas, and feel depressed. Cannabis definitely helps with nausea. Is that correct, Lisa?
Oh my goodness, yes. That is the reason why I use cannabis medicinally. Is I have chronic anxiety, which likes to manifest itself as chronic nausea. And luckily, cannabis helps with both of those things, both the underlying condition and the nausea that it presents itself with. So yes, cannabis does help with nausea. It's actually one of the things it's really most effective with. I know myself, I've taken prescription nausea reducers, and they have not worked nearly as effectively as cannabis does. So that's a big 10-4. Yes, cannabis does help with nausea.
And you had a comment about this, Greg. You say your answer is yes. You would need to know more about the cause of nausea. Is that right?
Yeah, as long as you figured out like what was causing nausea, like Lee was saying, it's like she knew what her underlying cause was, and then she knew it helped that, and that's the exactly right way to do that kind of thing and find out what works best. So that's the important part, to find out what's causing the nausea and then treat it like, to treat the underlying cause first, and then, find out what you can do, and then add medical marijuana if it's the right choice.
Right. That's a good idea, because some of the medications probably could be bringing a lot of that on. Question is, I have both insomnia and anxiety. Can a cannabis product, what cannabis product is best for both? Lisa, I think this is right up your alley, right?
Lisa.
Yeah, I would say, try something with a lot of CBD in there. CBD is one of the best anti-anxiety cannabinoids there is. THC can also be very effective for anxiety, but some people, about 1 in 10, do experience more anxiety with THC. So CBD is a little bit safer to start off with. Again, that 1-to-1 CBD to THC ratio is probably going to be an excellent place to start. And so maybe as an edible or a tincture, I would look for that 1-to-1 ratio.
Right. Yeah, that's a good tip as to which one to use. And you're right, it will help with both of them. Greg, you had some good comments about this as well.
Well, anxiety and insomnia, like two things that you really have to look at together to find out what went first. Mm-hmm. And Lisa has like a great idea of looking at this, when you're trying to figure out all of that and trying to figure out what works, and then the dosage and the type of medication that works with it, so the plan is right, but counseling is something that you have to think of. If it's anxiety related to something that's been unanswered, I wouldn't go straight to medications. If it was something else that had to be like figured out, and if it's like your mind is racing before you fall asleep, and that's what's causing the insomnia, then you have questions to answer before, like an hour before you fall asleep, for whatever reason. It doesn't have to be like, like a life altering kind of a question, but sometimes the day's events and things that you have to address those before you go to sleep that might keep you awake.
Good comment. Now, next question is fibromyalgia, pain, and sleep. Greg, you want some comments on that?
Fibromyalgia is different. It is a real kind of discomfort and real kind of pain during the day. But when I've looked at it at night by brainwave activity on dozens of patients with fibromyalgia versus like it could be like surgery, knee pain. It could be cancer, like pain that we think we call traditional. I see those with the alpha intrusion, and I see a lot of like arousals and things that can go on inside the brain. Fibromyalgia, I really, really don't see it showing up in brainwave activity during the night. It might be that kind of pain is slowed during the night, but it's got to be real. So I can't say that you treat fibromyalgia with anything pharmacologically before you go to sleep. If it does cause problems, then that's the idea, is that you try just about anything and see what works.
Right. And fibromyalgia, I'm doing a webinar in a couple of weeks on fibromyalgia, so please join us for that. But fibromyalgia can be addressed with medical cannabis, and that does address not only the pain but also the inflammation. Reducing those can probably help you sleep, I would say, right, Greg?
I would think so. Yeah.
There. So so take a look at that as an option to be able to help you in that particular situation. I take around 100 milligrams of THC every night to sleep. That's interesting. For my racing mind, how can I transition to CBD? Lisa, you want to take that one? Or you want me to take it?
Yeah, well, that's a lot of THC. That's a really high dose. And so I can totally understand why you would want to reduce that just from a cost point of view, because that's going to be pretty costly to do that regimen every single night. I would say start off slowly. If this is what works for you, then we want to not do a big change. And so I would say, maybe find something that's really, really high in CBD and combine those two products. So take like 90 milligrams of that THC and 10 milligrams of that CBD and see how that makes you feel. If
The
that works,
transitioning over, I think, to a 1-to-1 would help. quite a
then we
bit,
can
too.
transition a little for more and more. But I would just recommend just doing it slowly, because again, if this is what's working for you, then you don't want to just completely change your routine. And so slowly start to replace those milligrams of THC with CBD, and then you might be able to get down to doing, 20 milligrams of THC to 20 milligrams of CBD is a more common dosage that we would see that would actually help you out, I would say.
Yeah. Yeah,
So that's what I
agree.
would
And I think
recommend.
as you get more CBD into your regime, I think you'll find that the THC will become more effective. You need to use less THC to get the same effect. Let's put it that way, and also help you sleep. I think will help in that particular area.
Right. And
So
so
I
that's what I
recommend
would say.
starting
I would
with
just say
1-to-1.
slowly start to reduce the THC milligrams you're taking and replace those with the CBD. And then eventually you'll probably get to a 1-to-1 range. I don't know if you'll ever be able to completely, just go to pure CBD, because if you're responding really well to that THC and that's what's
Yeah.
getting the job done for you, completely transitioning to just pure CBD, it might not be as effective. But that's what I would say. Just slowly transition, adding more CBD and less THC night by night.
Yeah, and your body will tell you what's working and tell you what's
Mhm.
the best CBD to THC ratio.
And something else is up if you're using like a dose that can cause like a hypnotic effect, that you really, really in this instance have to look into like underlying cause.
Right.
I would say.
Yeah, this is a lot of THC to take at night. So
Oh,
something
yeah.
to pay attention to,
Yeah.
in my opinion. Again, everybody is different, but something to take a look at. What is the minimum level of THC to relax with a lot of CBD? Boy, that is a question of each person is different. Each individual person is different. I know that my tolerance for THC and my wife's tolerance for THC is on two different ends of the spectrum. So it's really hard to be able to say, here's exactly the level that's there. I do know that as you're looking at starting with I recommend starting low and going slow, usually with a 1-to-1 tincture. And then when you get to a point where you increase that from 0.25 or certain 0.125 milliliters to, the first line on the eyedropper, the second, you'll get to a point, you go to the third eyedropper, you'll begin to feel better. And then what you could do, if you go over that and you're not feeling as well, then that's when you back down. You found your tolerance to THC. At that point in time, you can then increase the amount of CBD. I think that's really the way that you should approach it. Not sure that we can give you an exact number, but there is a way that you could find out what that is. And that's again by going through going through the regime of finding out your therapeutic dosing level. Your thoughts on that, Lisa?
Yeah, I would say I agree with you. Everyone's different. So everyone's, happy spot with THC to CBD is going to be different. But I would say if you're concerned about the intoxicating effects of THC, and so you maybe want to minimize that, I would start maybe with a 2-to-1 instead of a 1-to-1, and really ease yourself into it. Like
2-to-1 is
Marc
2
and Greg have
CBD to 1
said, you can,
THC is what it is.
what's that?
That's what you mean. When you say 2-to-1, you mean 2 CBDs, 1
Yep.
CBD. That's the
Yep.
ratio.
And whenever you hear a ratio, a good way to remember is the CBD is always first because it's alphabetical. So CBD and then THC. That's how I remember it. But yeah, as Marc and Greg said, start with what works for you. Take it slow. And that 2-to-1 might be a good spot to start with if you're a little gun shy of the THC, which is totally fine.
Great. Good next question. I have been using 50 milliliters of a sativa product, but switched to a product with 15 CBD and 1 THC because it seems to mess with my sleep less. Are these normal expectations? And the answer is, I think the more CBD you use, probably will help you sleep a little bit better. You still need CBD THC in there, but I think this is something I would think would be rather normal. Your thoughts, Lisa? Great.
Yeah, I would say that's fairly normal. That's pretty expected. I would also say, switching from a sativa product to a non-sativa product was a good idea, because even though, sativa and indica, those terms are thrown about a little loosely, if something is labeled as a sativa, it typically means that it's meant for daytime and typically has more energizing properties. And so that might be why you have more success.
Yeah, evening indica is more the evening type of thing.
Yes, indica into bed. That's how a lot of people remember that one.
There you go. Good question here is, I am not allowed to smoke. What else can I use? I think there's a lot of different routes of administration. Lisa, this is right up your alley.
Yeah, absolutely. So, you've got your tinctures. Those are going to be a way for you to ingest orally that's a little faster, a little more akin to smoking. You have your edibles. Those are going to take longer to kick in, as was mentioned, but they do last longer. And so a lot of the times what people will do, especially before bed, is they'll combine those two methods. And so they'll use the sublingual drops, drop it underneath their tongue. It has that faster onset, so they have that feeling of sleepiness kick in. And then they'll eat that edible right before they hit the pillow, because then it releases and breaks down in the body while you're already asleep to help keep you asleep. You know, it takes longer to break down, but it does last longer in the system. And so those are two very popular ways to utilize non-smoking methods, specifically to help you sleep.
Right. And I do have to point out that edibles may take like an hour to work, maybe 2 hours, but you'll get that 4 to 10 hours. You'll get probably 6 to 10 hours of coverage as far as helping you sleep. I'm a chocoholic. So I take usually about an hour before I go to bed, I take a little square of chocolate, and it really helps me sleep during the night. I find if I don't do that, I'll wake up, and if I use a tincture or even inhalation, I'll wake up in the middle of the night, because again, the pain from my neck will come into play. So I find it using a product that will cover you throughout the whole night, like an edible, is probably not a bad idea.
Yeah, and a little pro tip when it comes to chocolate, if you are sensitive to caffeine, then go for the milk chocolates or even a white chocolate, because the darker the chocolate, the more caffeine it will have.
There you go. That's perfect. Good. Next question. If using flour would be if using flour, would you recommend a dry herb vaporizer versus smoking to avoid tars and carcinogens? Absolutely. I am a huge dry herb vaporizer fan. I do not I do not favor, I'm not against it, but I don't favor smoking a joint, primarily because of the tars and the carcinogens. Anytime you put things like that in your lungs, it's not going to help you. And again, if you're vaporizing the cannabis, you're not creating the tars or the carcinogens, which help quite a bit. I think this is really the best way to go. Your thoughts on it, Lisa?
Yeah, I think that vaping is a really excellent way to utilize flower products, or vaporizing a concentrate is a really great way if you need more oomph. I just want to point out the difference. Like, some people do have questions, what's the difference between smoking and vaping? So smoking is when there's actual fire, there's combustion happening. And vaporizing is when there's an indirect heat happening that is just enough heat to release those active ingredients, those cannabinoids and the terpenes, without burning them and exploding them. And so that's one reason why vaping can be more effective, is because you're getting more of those terpenes in your system. I will just say there is a little bit of a different feel. If you're looking for more of that psychoactive, elevated feel, vaping doesn't have quite as an intense feel that way. Smoking has a bit more of that, just because more is getting burned. But those are the two main differences between the vaping and the smoking. And vaping is definitely a great way to get all those terpenes without destroying them.
Yeah, and also, we were talking about other routes of administration. I'm sorry, Lee, can we go back to the other slide? I want to point out that sublingual, oral, or topical is alternatives to smoking or vaping. Something that's really there. Thank you, Lee. Next question. Why does my mouth get so dry when I do edibles for sleep? Lisa, you want to attack that one?
Dry mouth is a common symptom of using cannabis. Not everyone gets it. But I will say that a lot of times, through continued use, most people lose the dry mouth symptoms. So like over time, a lot of people who use cannabis no longer get dry mouth. But it is just an unfortunate side effect for some people. So it's not just you. It's other people as well. And I would say that's definitely exacerbated if you smoke or vape. So look out for that. Have a glass of water.
Sure. I will also say that sometimes I found that if I'm sleeping and I'll use the word heavily breathing, I tend to dry my mouth out just from the process that I'm using. So that also has something to affect that's in there. I might want to throw that in there.
Good point.
Greg, you've seen that, right, Greg?
Yes, indeed.
It's there. Great. Next question is, can you suggest a strain that does not induce hunger? I think rather than talking about a strain, I think you're going to talk about strains, Lisa, in case you have some. But I think you're looking at strains that are kind of high in humulene. That would help quite a bit.
Correct. Yeah, that humulene. Humulene is the same stuff that's in the hops that is in an IPA beer. And so if you've noticed after having an IPA beer, you feel really full, it's because it's super high in humulene. It's the same thing. And so if you look for something that's really high in humulene, that's going to be your best bet at not getting the munchies. And again, right now in stores, we have Frit, short for apple fritter, and 007 that are both have humulene as a top 3 terpene. And so that would be a good bet for you to try out.
Susan, thanks for
it's not a
asking
miracle worker, but it does help.
Susan, thank you very much for asking that question. Are there long-term side effects that may contribute to dementia and Alzheimer's? I have done, I've been studying cannabis for 10 years. I've got a degree in a medical cannabis practitioner's degree, and I have not seen a study that says cannabis contributes to dementia and Alzheimer's. And Greg, I'll kind of refer you to that. Maybe you've seen one, but I haven't seen one. I have seen studies where cannabis has been able to address dementia and Alzheimer's, not get rid of it, but slow it down and be able to help people to be able to address it. Greg, have you seen any studies that the cannabis contributes to Alzheimer's and dementia?
No, I haven't seen anything like that. But I can't say that it wouldn't do it, but I haven't seen anything that would like hasten the response and to develop some kind of neurological problem.
Yeah.
So I'm sure they're looking at it. I could probably give everyone a better response in about couple of days.
Yeah. Well, again, I haven't seen the study, but I do know I have studied. I have an Alzheimer's patient and I have 2 dementia patients that I work with, and we're using medical cannabis to be able to address their particular conditions. Does regular cannabis use impact the REM cycle, and what long-term positive and/or negative consequences can be expected from it? I do know that cannabis will help you relax. I think it'll be able to help you. It'll bring on the REM cycle. As far as the positive and negative consequences from being able to use cannabis, again, it's different for every person. We haven't seen a lot of negative consequences with respect to sleep. We've seen a lot of positive consequences, but also if you're using too much THC and you're above your what I call your tolerance for THC, can make you more anxious, and it will basically make you more anxious and be able to affect your sleep and be able to get good quality sleep. So cannabis helps to improve the REM cycle, but again, make sure you get the right dosing, because the right dosing is really the key to be able to answer that particular question. Let's jump into the next question. Can medical marijuana help with nightmares, especially for those living with PTS? You want to attack that, Lisa, or you want me to take that one?
Take that one. It's really interesting. Actually, Greg had mentioned in the video that, sometimes cannabis can disrupt dreams. And it overall doesn't affect your sleep health for the most part, but it can disrupt dreams. And we actually have seen numerous veterans come in and use cannabis for that purpose. They have, nightmares, and, night terrors. And by slightly disrupting that REM cycle so that you're not getting quite as intense dreams, we have seen people treat those terrors with cannabis effectively. So it may help you.
Yeah. And it's related to the other question about how using a particular product, a 1-to-1, really, one time it helps you sleep, and the other side brings on potentially strong dreams. Greg, your comments on that? What brings on nightmares?
Can you hear me?
Yeah, we can hear you now. There you go.
Oh, good.
We're addressing what brings on nightmares.
Well, there's a difference between nightmares and night terrors. Nightmares occur during dream state sleep, REM sleep, and night terrors are during deep sleep. But the idea, of medical marijuana helping like PTSD is, I think it's a good idea. But marijuana affects the amount of REM sleep, and it delays like the REM onset. Just because it resembles the tricyclic amines like amitriptyline, some of the antidepressants. I think it would help. I think it would help the veterans, especially in some place like Texas, to try medical marijuana to see if it would like influence like nightmares that would happen during REM sleep.
Mm-hmm. Good point. Next question is, in addition to sleep apnea, I deal with Parkinson's, heart disease, and chronic back pain. contradictions with medical marijuana. First of all, I want to point out something right now. Anytime you're dealing with any condition related to the heart, I highly recommend, in fact, I would strongly recommend that you get your medical doctor and your medical marijuana doctor working together. Cannabis is distributed throughout your body through your bloodstream, and it can have some effect on the heart. You need to address your dosages on both sides, both the medical cannabis and also with the medications that's out there. So I would say, first of all, work with your doctors, and be able to address that one. I don't want to really head you down a path that could potentially be fatal. That's there. Your thoughts on that, Greg?
Yeah, absolutely. There was something else that was wrong that she was looking at. What was it besides
Parkinson's
of
and chronic back pain.
the back pain? Of course, you know that it could help the cardiovascular issues. You always have to work with a physician to make sure that was going on. But she had something else that was happening, wasn't there?
It was Parkinson's, heart disease, and chronic back pain. Oh, sleep apnea. Excuse me, sleep apnea. Sorry about that.
Yeah, and the sleep apnea. Well, definitely don't think that medical marijuana is going to like stop any of those. It could help some of those, but don't use medical marijuana like an off-label kind of thing to help sleep apnea. Sometimes surgery helps with sleep apnea if it's like mild, and there's a lot of issues with like upper airway, like obstruction, like tonsils are in the way, adenoids in the way, soft palate, that kind of thing. But you have to look at it, you know, first trying, I would try like that CPAP therapy, that positive pressure therapy with a mask, to make sure you're doing the sleep apnea well, that could help the heart problems. And then the Parkinson's is always a difficult thing to see what else can go on. Pharmacology is pretty much the only thing that I've seen that would help that.
Good point. Good point. Let's run on to the next question and see what we have here. There you go. Can medical marijuana help with sleep apnea in any way? Greg, you want to take that one?
Yeah, exactly. You know, following up on that other one, it depends. You know, when we are in REM sleep, rapid eye movement sleep, dream state sleep, that happens like 4 or 6 times a night normally, and gets longer as the night goes on. You have most of your REM sleep or dream state sleep in the last third of the night. And when everyone dreams, you're paralyzed. That means you can't move and flail around while you're in your dreams, and your soft tissue in your upper airway also relaxes, and it can make sleep breathing problems worse in REM sleep. So if like medical marijuana like suppresses REM sleep, it can make some of that sleep apnea go away and could make you feel better. I wouldn't do it.
Okay. Next question is, I'm up during the night at least 5 times. Let's see, I can't see the other part. I have a CPAP and it isn't helping. Suggestions. Greg, your thoughts on that?
Well, if the CPAP machine is waking you up, that's one thing. But if you're waking up to go to the bathroom 5 times a night, it could be in subtherapeutic pressure on the CPAP machine, something else to look at. But anytime you're waking up 5 times a night, if you wake up with a dry mouth, that means the machine's leaking and you're just having an issue. It could be it's leaking during REM sleep that happens 5 or 6 times a night, or the subtherapeutic pressure during REM sleep. You need to check that out with a sleep physician to find out what really is going on.
Yeah, I think that's something to pay attention to. Again, you know, I think the affliction of a male that's over the age of 50 is you're going to wake up at least once a night to go to the bathroom, maybe twice or more. But I think that 5 times is getting up to the high end of that. But
when it's more than that, yeah, it's either benign prosthetic hypertrophy or undiagnosed sleep apnea, generally.
Right. Good point. Next question is, how can I get a prescription and get products? Well, first of all, to get a medical marijuana card, it's important that you find a medical marijuana doctor. I recommend the medical marijuana treatment clinics here in Florida. They have 23 locations, and they'll be able to help you. You can contact them bring your medical records in. Your doctor will then put you into the state registry. By the way, this not only works in Florida, it works in other states. It's the same process where you find a medical marijuana doctor. What they're able to do is they actually are verifying to the state that you have a medical condition that qualifies for their program. They put you into the program. And then what you're doing is from there, what you're doing is you're being able to get a card. And what that card allows you to do is a card then allows you to go out and to be able to buy products at a local dispensary. So first step, schedule an appointment. Second is once your doctor puts you in the registry, you do have to go out and you do have to pay for a card from the state, just like you get a driver's license. Here in the state of Florida, it's $77 right now. And then once you have that, then you can go to a dispensary. Now, what you're not going to get is you're not going to get a prescription. This is not a process where they say, take 2 pills and I'll see you in the morning. What you really have to do is go back and really find out what your therapeutic dosing level is with the product that you like, the route of administration. And then once you get to that particular point, you can then up the amount of CBD to really find out, you really fine tune it, really that's for your body. It's hard, not only just for medical cannabis, but also for prescription drugs to really find out what is the right prescription. What doctors do when you get a pharma drug is they give you the lowest possible dosage and see if that works. And that's why they say, call me in the morning because it may not work. In the case of medical cannabis, you can make the adjustments and you can listen to your body to get there. When you're using pharma drugs, you really have to work with a doctor constantly for that. So the answer is you're not going to get a prescription. You're going to get a recommendation. The recommendation is going to be what type of products to use. And then where can you get products? Places like INSA from the dispensaries themselves once you get a card. And I hope that answers that particular question. It's there. Let me jump to the last question. If I got a card, would I still be able to carry my concealed weapon? And the answer is yes. You can be able to carry a concealed weapon. You can get a concealed weapons permit. What you have to be careful of is buying a weapon. And the reason for that is because up until about 2 months ago, the federal government had a form that you had to fill out when you bought a weapon, and it asked you specifically if you were using marijuana for any reason, including medical marijuana. If you answered yes, there was probably a good chance that they wouldn't approve that. Now, there was a lawsuit that came in, and the appeals have already gone through, that has basically stopped the federal government from stopping people from getting medical cannabis. Stopping people from getting a weapon if they're using medical cannabis. However, that lawsuit was put in place a couple of months ago. That doesn't mean that that's necessarily the policy of every state that's out there. It really is something that's being slow rolled by a lot of the states. So carrying a concealed weapon, no problem. Buying a weapon, it's kind of you have to see the current appetite the state has to be able to do that. I know people here in Florida that have bought a weapon once they had their medical marijuana card. But again, that doesn't necessarily mean it happens across the board in every state and candidly in every county. So I hope that answers that particular question. Let's run into the questions that were asked during the webinar. Keith was asking, is medicating with marijuana, is that not non-natural sleep? I heard that sleeping pills and stuff are given out, giving you the right natural sleep. So what about medications for marijuana? I think that medical marijuana is probably the most natural form of sleep from a medication. I think we talked about that earlier. Greg, your thoughts on that? Is that correct? Greg in his car. Greg, we're losing your audio here for a second.
I think muted, Greg.
Yeah.
Wait.
There you go. Now you're back. So the question is medical marijuana, how natural is medical marijuana, the sleep brought on by medical marijuana?
I think it is a good way. I think it's like a good way if you're doing it with the idea that you have enough sleep pressure built up during the day and you're on the backside of circadian rhythm to fall asleep naturally, still having a bit of a tough time. Medical marijuana to push you over the edge to fall asleep naturally. It will affect some of your REM sleep, most likely just delay the first REM period. But I don't think it's going to change a lot of things a lot of times like some other medications will.
Right. I think it's probably one of the more natural ways of helping you out to be able to get the sleep that you need. Susan asked a great question. Where can we access the link for the Epworth scale? First of all, Susan, as a follow-up to this email, or excuse me, this webinar, you'll get an email from us, and in that email will be a link to the YouTube video for sleep, a copy of this, link to the video of the webinar itself, which has the questions and answers in it. It'll give you a copy of the presentation in flipbook format, but we'll also include a link to the Epworth scale, so you can figure out, which you can actually click on that and be able to download that particular scale that's out there. And also, if you go to YouTube and you look at this particular video on YouTube, part of the below, you'll see different areas that we put different links, and it's in there as well. So you should get an email from us. That's probably going to be the easiest way to find it. But also, you'll be able to get it from YouTube tonight if you want to be able to do that. Cheryl asked the question: does each individual dispensary carry the same product? For example, will you find the same products at Cetera and Curaleaf? That goes back to the question, Lisa, that Jack Herrera is not Jack Herrera is not Jack Herrera, right? That type of strain. Are they the same products?
This is a really great question. And the answer is, in Florida, no, because each dispensary has to grow and create their own products. We're not allowed to wholesale and share in Florida. And so all of the products that you would get at an INSA dispensary are, just special to INSA. We grow them and we make them ourselves, and we don't have any other manufacturers in our stores. That being said, there are some certain strains or cultivars that you will find at multiple places. For instance, like Blue Dream is a really popular one that you'll find at a lot of different places. Girl Scout cookies, they might have slightly different names to, meet the regulations that Florida has for naming. But there may be some definite overlap with flower types, but the actual product itself is going to be, by the individual manufacturer. So I hope that answers your question.
They're all grown botanically, and they basically come from the same strains, but as they're being grown by each of the manufacturers, it could be slightly different terpene profiles and flavonoid profiles.
Absolutely. If we both buy the same rose cutting, it's a clone of the same rose, yours might grow one way, mine's going to grow another one based on the different, environmental conditions. And so even if there is a Blue Dream at INSA and a Blue Dream at Curaleaf, for example, there's going to be some differences between them just because of the way that they grew up.
Right. And I think it's important to point out, fundamentally, they're the same products. The difference you're going to see is slight differences in the terpene profiles, but fundamentally, from a cannabinoid standpoint, they're pretty much the same.
And that's why we emphasize education with our team. Is we want to be able to help somebody come in who has a strain or a cultivar that's really effective for them, and maybe we don't carry it, but we can do a dive into what terpenes are in there, what the cannabinoid profile is like, and match you up with something that's very similar, if not better at times.
Great. Next question. Does an individual dispensary, we just did that.
Yes.
How close to bedtime would you want to dose for better sleep? And again, I'm going to let you take this one, Lisa, but I think a lot of this has to do with the actual route of administration you're using. So for example, if you're using an edible, it'd be about an hour. If you're using a tincture, it'd probably be 20 minutes. Why don't you give us some guidelines on that, Lisa?
Yeah, so most of the time when we get this question, we follow up with, well, what do you have the most problem with? Do you have the most problem falling asleep, or do you have the most problem staying asleep? Or sometimes it's both. And so if it's, falling asleep, then I would say you want a route of administration, such as a tincture that's going to, or vaporizer or flower, that is going to have a very fast onset, 10 to 15 minutes. And that you can, do about half an hour before bed would probably be fine. If you want something that's going to help you stay asleep, you don't necessarily have a problem falling asleep, then you're going to want to have that, a little bit of chocolate, that gummy, or that edible that's going to have that longer release time, maybe like an hour and a half before bed, like Marc does. His routine is pretty typical, and it works really well for most people.
Good. Desiree asked questions. I came in late. Sorry. What terpenes for falling asleep? Give us your terpenes again, Lisa. Top three.
Linalool, caryophyllene, also said caryophyllene, and humulene are top three that I would say are really good to look for.
Sure, perfect. Colleen asked a question. Do the drops also give you a high feeling like taking edibles. First, I want to point out that most edibles don't have, are mainly almost all THC. Only a few high quality dispensaries have edibles that have ratios in them and have terpenes in them, like for example, INSA. So I think it's important to point out, look at the certificate of analysis, COA, on the edibles, and that'll help you guide whether it's something you want to really take a look at or not. Now, I think you can get high from using tincture drops, just like edibles. Is that correct, Lisa?
You can, you just want to watch your dosage. You know, it's going to be a little bit more difficult to feel that uncomfortable high feeling with a drop than it is with an edible, just because of the different ways that your body breaks them down. And you know, you're able to maybe control your dosage a little bit easier with a tincture because you're able to feel the effects faster. It's not like Mark said, where you're just waiting and waiting and then suddenly it hits you. And so I would say, yes, it definitely has that potential to give you the high feeling, but it's probably a little bit easier to control and avoid that if you want to avoid it than taking an edible.
Sure. Next question is, how much, you didn't talk much about your chocolates. Lisa, we could talk all night about your chocolates. I think the main thing is not necessarily to talk a lot about it, but just really to make, I think there's 3 key points, and I'm going to have you go over this. One is your quality of your product. With the Belgian chocolates, your chocolates are, by the way, I think the best on the market because of the quality. You also have a chef that's involved. And I think also what I was impressed when I went through your dispensary was the attention to detail that you put into making sure that you had the right both terpenes as well as the strains in that particular chocolate, really to address a number of conditions. Your thoughts on that, Lisa?
Yeah, so we have a lot of different varieties, you know, not only different varieties in terms of flavors, which I am a little jealous. You guys in Florida have more different varieties of chocolate than we do up here, but also, you know, the different infusion methods. So if something is just like a pure distillate, pure THC, we definitely have those. And we also have the full spectrum oil, the FSO bars that do have the terpenes in there as well. And so we have a wide range of those chocolates, and they're really enjoyable to use. In fact, we like to recommend, you know, taking your dosage and then just putting the rest away, so you're not tempted to just keep eating them, because it really is that good.
Don't put much in these things like a Hershey bar.
I know. Well, it's better than a Hershey bar, but
yeah, they taste really good, and that's the temptation. You really got to resist that temptation, seriously.
Yeah, we like to say it's more like Ghirardelli than Hershey, because it's just that
true.
high scale
no
of
question.
chocolate.
No question. And Lisa, you're with a dispensary called INSA. For those that are out there, why don't you tell them what INSA stands for?
So INSA is a combination of indica and sativa put together. It's a portmanteau. And we have that as our name to show our dedication to crafting world-class hybrids, basically. We want to make a really wide range of hybrids that are going to fit a lot of different needs that people have. And really cool thing that we do here at INSA is we actually create brand new strains and cultivars that nobody has in the entire world, basically to try to fit different needs that our patients have.
Yeah, it goes back to what we talked about earlier, cultivars being made really to address different medical conditions. And you guys
Absolutely.
Cool. Okay, so let's see what else we have here. Okay, any recommendations for women experiencing insomnia due to premenopausal or menopausal or perimenopausal conditions? You want to take that one, Lisa?
Yeah, that's a tougher one. I would say if you're going to look for a terpene profile, you know, the 1-to-1 THC to CBD ratio is definitely still going to be a great place for you to start. If you're looking for a specific terpene profile, I would look for something that's really high in caryophyllene or caryophyllene. And the reason is because that terpene acts uniquely from other terpenes in that it acts as almost like a bonus cannabinoid. It attaches to your system much the same way that like CBD does. And so having more of that will basically just give you more opportunity to cover what your body might be missing or might be needing. That's what I would say to start off with. I'm not sure exactly. I mean, Greg, that's probably more up your speed, the different ways that menopause can affect your sleep.
Yeah.
Postmenopausal insomnia is a bugaboo. It is very difficult, even with like medications like with Ambien and things like that. Everything else has been settled. You're like the way you do sleep hygiene is above board, and you still can't sleep. There's some things like the natto beans, the sticky beans from Japan, that seems to help, but there is no good way. I've seen Ambien leave off postmenopausal age women off of their tables for research just because it did not work. So making sure you like solved all the underlying problems, and then trying like medical marijuana, I believe may have like a very good positive influence on sleep onset for postmenopausal age women. There's not a lot of good things out there to help. I apologize for that.
Yeah. Keith asked a great question. When are you going to start delivering? Lisa,
That's something that's something we're actually looking into right now. So hopefully we will have delivery for all of Florida up and running in the very near future.
Good. I know it's on your menu, and it takes a little bit to get the logistics coordinated, but I know that's something coming to a dispensary near you. Let's put it that way.
Yes, for sure. We're still a little new in Florida, and so we wanted to get our feet first before we started doing delivery, but that's definitely something that's on our docket for the future.
Andrew asked a question: is Blackberry Kush by Via Hemp good company good for sleep? I have no idea what that product is. I've never heard of it. That doesn't mean it's not a good product. I just don't know, and I'm not going to comment on it because I just don't know it. So I would kind of defer that question to whoever's providing that particular product. I would say though that most hemp products are very low in THC, 0.3% THC, and you may need a little higher THC to be able to really address sleep, especially if pain is involved in that. So you may need a medical marijuana product, not necessarily a hemp product, to be able to help you with that. Let's jump on to the next one. It's from Raul. It says, I'm successful using 20 milligrams of GHP, sublingual tincture, for great sleep for 2 hours. However, I found that if I occasionally take a higher dose, I will fall asleep easier, but I wake up in 1 to 2 hours when blood pressure peaks. I'm wide awake for an hour or two. Is this common or an anomaly? This has to do with dosing, though. A lot of people will find that when you find your therapeutic dosing level, that's something that you're very comfortable with. If you go above that, and you say, well, if I increase that, it may bring on that anxiety, and what you're probably doing is you're going above your therapeutic dosing level. So it is common. I would say back down, go to the level that works for you, and keep it there, because I think more is not necessarily better. Your thoughts on that, Greg?
Well, I was trying to check out the question more, and I couldn't exactly figure out what he was trying to say exactly. And
I think it's the dosing issue, Greg. I think if he's waking up in 2 or 3 hours, that has to do, especially if his blood levels peaking. What happens is he's getting a negative reaction from using the cannabis, and that negative reaction is by getting past his therapeutic dosing level. He just needs to back down to where he was before, and that'll really help him get back to the sleep that he's really looking.
Yeah, trying to back down to find out what was causing that awakening 1 to 2 hours. And as always, if anybody's taking anything else, even drinking a couple of beers or something like that, it'll help get to sleep faster. But as soon as the alcohol is metabolized, you'll start waking up more frequently. It will undo all those benefits of getting deeper sleep faster. So it's hard to say what he's doing before sleep onset.
Jessica, great, thank you, Greg. Jessica asked a great question. Can you name products other than flour that are high in humulene? Lisa, I think that's in your bailiwick.
Yeah, so what's excellent about INSA is that we try to take that base flour, so those base strains. So I've been saying that App Frit and 007 are two that we have on the menu right now that are high in humulene, and we use them to create other products. And so we have that strain in a vaporizer, in a concentrate like a batter or a wax. And so if you don't use flour and you prefer to use something like an RSO syringe or something like that, those strains are available in other forms because we use those as the base to create these other products.
Good. Yeah, and you have different routes of administration. We had that one slide that you'll get that everyone will get a copy of in the follow-up that you can be able to take a look at. Catherine asked a question. Do you know INSA's opening in Gainesville? I
I'm
don't know if you
looking
know
right
that.
now to see where Gainesville is and seeing where
Gainesville is like a little northeast of Orlando.
I just want to search by the zip codes. I can see where the closest
And
one.
I graduated there, University of Florida.
Okay. Well,
North
I
of
know
We know where the Gators come from, is that right?
in Gatorade.
Yeah, there you go. Anyway,
so we don't have a location in Gainesville currently. We are looking to open up some more locations next year, though. Let me see what the closest one to you would be. Looks like it would be the Villages or our location in Jacksonville, are the closest to Gainesville.
yeah,
Wow.
okay. So,
Lisa, that's disappointing.
I'm sorry. I'm sorry. It's
Well, I
worth the
think we've
trip,
answered-
though.
yeah. Well, I think we've answered almost all the questions that are out there. What I want to do is actually do a wrap up. And before I do that, I want to thank everyone. We've gone a long time and we've answered a lot of questions about medical cannabis. And I do want to say there's some areas that you can take a look at if you're looking at getting a card. I recommend the Medical Marijuana Treatment Clinics of Florida. I recommend not only INSA, Cetera, there's very good dispensaries that are out there. INSA is one that I think will help quite a bit. Naturally, if you're looking at CBD products, we have the products from My Botanical Wellness. But I do want to point out, please take a look at our YouTube channel, The Marijuana Aware. You'll find not only in this video on sleep, and not only in the video by itself, but also the webinar. There's two separate things that are there. And also because of sleep, Greg and I recorded something about sleep in general, not necessarily related to medical marijuana, but something that can really help you quite a bit. But it's something that's really there. And I want to thank everybody for spending the time. I also want to thank a couple of folks, Leah and Leah in the background, who've been putting up a lot of graphics and helping to answer a lot of questions. I want to thank them very much for that. But let's talk about some closing comments. Lisa, you want to start?
I would just say that, cannabis isn't necessarily for everyone, but it does help a lot of people. And helping with sleep is one of the most popular reasons that people use cannabis. And so if you have problems with sleep and you've tried some things and it doesn't seem to be working and you're curious about cannabis, definitely come see us, come talk to us, have a consultation. You don't need to book it. You don't need to schedule it. Just walk on in and everyone will be happy to talk to you about any questions that you may have. And if you do have your medical certification, definitely come see us. And we do have some amazing new patient benefits. So check out INSA.com to see what those are. And yeah, I hope everyone had a good time tonight. And I would really like to thank you, Marc, for having us here.
And I should point out, you're going to be opening up more dispensaries. I know I've talked to some of your folks, and you're being very you're not making any commitments, but I know you're going to be opening a number of dispensaries here in Florida. So
yes, I believe the next one's going to be Orlando, and we're hoping to have it by the end of the year. If not early next year.
We already have one already.
Yes, another one in Orlando. Yes.
Lisa, thank you very much. We really appreciate your comments. Greg, as always, great job. Any comments? Closing comments?
For everybody, remember, treat the underlying sleeping disorder if there is a problem there, including insomnia or some simple things. Try not to overuse anything, including medical marijuana, because it could affect your sleep patterns. And another just a couple of short things. I had to take my daughter to ballet. And Lisa, I thought your name was Leah. I apologize for that. That's my wife's name. And Leah, and Lisa, all of it all blended in with me.
We did that on purpose, Greg. We wanted to see if you were sticking with us or not. That's all.
I was paying attention until you said something, Marc. So Lisa, again, I apologize.
Well, Greg, thank you very much. I know that you've done a good job of explaining not only the underlying conditions. I think medical marijuana, like any medication, is not a magic wand. There's no magic wand. There's no fairy dust that's out there. But there are treatments that you can look at. And I think the key to medical cannabis is really listen to your body. Your body will tell you what's working, what's not working. And I think that's what's really important. That's what I like about medical cannabis is I found that I can actually make the adjustments and really get the treatments that I need. And no doctor's going to tell you how your body feels. your body will tell you. And I think that's really, really, really important. And that's very counterintuitive than what you find with we've been taught since I grew up about going to a doctor and asking for 2 pills in the morning. And then calling the doctor constantly to get the prescriptions right. So anyway, listen, I want to thank everyone for hanging in there for almost 2 hours. Leah, Lisa, and Greg, thank you very much. And I do want to thank again Lee and Leah for the background for the work that's done, and also throw a special shout out to Elisa Katera, the lady who actually came up with the idea of this particular webinar series. So listen, thank everyone for joining us. Please join us in 2 weeks. We're going to be doing a webinar on cancer, chemotherapy, and medical marijuana. And that's something I think could be of interest to some folks. So thank you for joining us, and check us out on our YouTube channel. We look forward to seeing you in the future.